Hello everyone, I'm David and welcome back to another first aid skills video. I know last week I said we wouldn't be doing any more theory stuff. Unfortunately this week we have to do one more. I'm on the road right now and I don't have access to all my equipment. So I'm going to go over a quick theory to start off what we call the secondary assessment. Next week we'll be getting into the hands-on stuff because then I have my equipment and I'm able to do it. So the secondary assessment is what we do after our primary assessment, which is what we did last week, which was covering looking for any life-threatening injuries, your ABCs and all that kind of stuff. So the secondary assessment is done after that, once you figured out that there's nothing life-threatening that you have to deal with, and so you can have a more slow and detailed overview of the person you're working with. So there's 3 steps to the secondary assessment. The first one is asking questions, which we use the acronym SAMPLE for that. I'll go over what that all means in a minute. The second one is checking the quality of the person's vitals. And then the third one is doing an injury check, which will be hands-on stuff. So we're going to cover the first 2, asking questions and checking the vitals. So the first one, your questions. So these ones you want to ask the person that's ill or injured if they're conscious and they can respond to your questions. If not, hopefully they have a bystander with them or someone that knows them that you can ask these questions. So the first one, S, signs and symptoms. So ask, do they feel any pain? Does anything feel off? Any cuts or bruises? Just stuff like that, anything that's different. Allergies, A, pretty easy, ask if they have any allergies. This may give you right away what's wrong. If they're allergic to bees and they have a bee sting, you know what's wrong there. M is medications. So do they take any medications and what is it for? Have they taken their medications lately for what they need? Then you do P, which is past medical history. So has this ever happened before with, I guess, kind of, do they have any past of it? Like if they feel chest pain, do they have a past of feeling chest pain, or if this is something new? Then you want to do L, which is last oral intake. You want to know what they ate last, when they ate it last. This could tie into the allergies, or it could tie in if they need something done at the hospital. You can pass this on to the ambulance and then they know when they ate something last. And the last thing is events leading up to. So you ask, what were you doing before this happened? Because that can give signs based on body stress and stuff like that that might have brought up the symptoms that they're having. And so checking the vital signs. So this is the second one. Checking the vital signs, we want to start off with level responsiveness. If you asked all these questions to them and they're responding, they're alert. If they're not responding, then they're not alert. So, and level of responsiveness can change throughout, so you want to make sure you keep track of this. Then you want to look at their breathing. Breathing is really important. We went over it, breathing in our primary assessment. So the secondary one is just kind of keeping track of it, making sure it doesn't get any worse. And then skin. So we want to look at the skin because this helps us decide and keep track of their circulation. So look at their skin color. Are they sweaty? Are they dry? Are they pale? Is it normal skin color? Just kind of stuff like that. For breathing, now breathing can change as time goes on and as things get better, because breathing can be caused by just hyperventilating. So if you calm the person down, their breathing might go down. It can be caused by blood loss. So if you control breathing, their breathing might return back to normal and that kind of stuff. So the more we take care of someone, the better their vital signs can actually get. So that's it for this video. That was quick and easy. We went over sample, signs and symptoms, allergies, medications, past medical history, last oral intake, and events leading up to, and checking vital signs, which is their level of responsiveness, breathing, and checking their skin. So next week we're going to go over doing an injury check, which is hands-on, and I'll have the mannequins and stuff for next week, so we'll be able to get that done. So thanks for tuning in this week, and I hope to see you all next week. Bye.